My name is Colleen Corris, and I'm doing my video on common bone features. The first feature is the articular surface. This is a smooth area of compact bone where the bones come in contact with each other to form a joint. Each articular surface is covered in this smooth, thin layer of hyaline cartilage called articular cartilage. This is smooth and soft, which helps reduce the friction when the joint's moving. Next is the condyle. A condyle is a large, round articular surface located at the distal end of the humerus and the femur, and there's also one on the occipital bone of the skull. So these are the condyles here, this round surface right here. This is the distal end of the femur, and you can see the medial and lateral condyles there, that nice round surface. Next is the head. So the head is a spherical surface at the proximal end of the humerus and femur, as well as the ribs. This is the ball in the ball and socket joint. So this is the head of a femur, and you can see it's the nice round process of the top proximal end of the femur. Next is a facet. So this is a flat articular surface in a joint. So instead of the ball and socket, this one's flat. So the joint movement is more of a rocking motion, like the carpal and tarsal bones. So this is a gliding joint, like this carpus you can see here. So in between these short bones here of the joint, you'll get that rocking motion. So that's a facet, and that will also be covered with articular cartilage. Next is processes. So processes are all sorts of lumps, bumps, any projection on a bone. The head and condyles are actually joint forming processes, so they're kind of both. Others have rough or irregular surfaces, like this irregular bone of the vertebrae. And processes are where muscles or tendons attach to the bone. So this vertebrae has the transverse processes at the sides here. There's the spinous process, which is the big one at the top here. And then there is the cranial articular process, which is that one back there, and the caudal articular process, which are these ones up here. So this is where all where muscles and tendons would attach to the vertebrae. The olecranon is actually another process. So right here in the elbow, that's another example of a process. So it's just a projection of bone. Next is fossas. So fossas are a depression or sunken area on a surface of a bone, and this is where muscles or tendons nestle. So this isn't to be confused with a process where muscles or tendons attach. This is a depression where they nestle and they kind of rest there. So this is the scapula, and there's two fossas here. There's the supraspinous fossa, where a muscle would nestle, and the infraspinous fossa, where another muscle would nestle on either side of the spine of the scapula there. So this is another really good picture of an example of a fossa. So you can see this really clear, nice little depression, little groove here, where the tendon that holds the patella there, this is the femur. So the patella nestles right there in that little groove. So that's an example of a fossa. Next is foramen, or holes. So these are holes in the bone. They're usually where a nerve or blood vessel pass through. So you can see one really clearly right here. This is the distal end of a humerus. There's this little tiny hole here where nerves and blood vessels can pass. And then the other example is on the pelvis. So there's these big holes called obturata foramen, and these are in the pelvis, and the purpose for these are not actually for nerve or blood vessels to pass through. In this case, the foramen's purpose is to lighten the load of the bone, so it's not as heavy. That is my presentation on common bone features. Thank you for listening.